Hello, I am Jordan Acuna, a graduate student at the University of Texas at Arlington in the Master's of Science in Nursing Administration program. And today I'll be reviewing the Comprehensive Strategic and Marketing Plan for Hospice Brazos Valley. To begin, Hospice Brazos Valley has been and continues to be the only nonprofit serving 17 counties in Central Texas since 1989. We are dedicated to providing patient-centered care to those in their end-of-life journey in our communities. Our main office is located in Bryan, Texas, with alternate delivery service sites in Brenham, Texas, and LaGrange, Texas as well. When analyzing market share of patients served, it has been determined that 76% of patients are concentrated in Brazos, Washington, and Fayette counties, with an additional 17.4% of those patients concentrated in Burleson, Lee, Austin, Colorado, and Grimes counties. Our mission is to help navigate the end-of-life journey, which is actualized through our vision statement that we will be an integral part of the community as a leader in end-of-life care, fostering a new cultural attitude for quality of life. Our mission and vision are upheld through our core values of compassion, accountability, respect, and excellence. Our care process and model is comprised of giving care provided in patients' homes, skilled nursing facilities, assisted living facilities, and hospitals. Myself, I'm the Director of Nursing for Bryan College Station service area, in addition to overseeing the admissions team for the entire agency. There's an additional Director of Nursing for Brenham and LaGrange service areas. Our staff includes registered nurse case managers who have a patient-to-nurse ratio of 12 patients to 1 nurse per caseload. We have admissions RNs who on average perform 2 to 3 patient admissions per day per position. We have LVN clinical support staff and a PRN float pool that's comprised of RNs and LVNs. Our strategic plan was developed through a committee, and in that committee, we established priority pillars made up of the patients and families, team members, and community, as well as growth. The objectives include developing an improved comprehensive marketing plan with maintained excellence in our field and remaining the lead community hospice resource by staying competitive within the market. The main plan is to grow the number of admissions by 15% volume over the next 3 years. There are 3 strategic measures to achieve these numbers, and that includes utilization of online referral platforms, addition of a registered nurse marketing liaison position, and enhancing our digital marketing campaigns. During year 1, this is where we will buy into the online referral subscription services. The targeted audience is our local hospitals in addition to some of the long distance ones. There are a few hospital systems such as Baylor Scott & White and St. Mark's Medical Center that utilize a free platform service accessed through an account using the agency provider number. Our other hospital systems that we frequently receive patient referrals from are Catholic Health Initiative or Common Spirit, MD Anderson, St. David's Health System, and Austin Heart. All of those hospital organizations use the same referral program that is a $1,200 annual fee with a one-time buy-in fee of $500. We will see immediate benefits upon initiation of these platforms. It will allow for a smoother transition of care and referral system. And there will be no additional costs incurred as we already have the required technology to support all of this. During year 2, this will be the creation, onboarding, and building of the strategic nurse liaison position. This position's target role is to build more strategic relationships with our local providers, be the lead hospice educator to our community partners, and also provide rapid response for urgent information and evaluation visits for patients either in the hospital or at times in the local physician offices. It is a full-time position at 40 hours a week with entry-level pay of approximately $35 an hour. Bonuses of $500 per month if referral admission goals are met would be an added incentive. So a projected annual salary cost plus incentives would be around $78,800. During year 3 of our strategic plan is the expansion of our digital marketing campaigns. This will include creation of new commercials, paid advertisement slots on local radio stations, and then utilizing an enhanced geofencing within our community. Projected cost of the commercials and radio slots would be around $10,000. And then the geofencing is expected to hit around $3,000 with an annual ongoing fee of $5,000 to maintain these projects. For our marketing plan, as mentioned before, we have payer mixes of Medicare, Medicaid, private insurance, veterans benefits, and indigent care. Medicare makes up over 84% of our payer source mix, and our current data reflects that as an organization, Hospice Brazos Valley holds 35% of the market share of hospice eligible patients. And that number is anticipated to grow within our community of hospice eligible patients due to having increased numbers of retirement communities being built, as well as families relocating back to this area for jobs or be back around their alma mater of Texas A&M University. The marketing plan phases of the online referral platform will fall under the Director of Nursing and Chief Operating Officer for the purchasing of or contracting of this platform system and teaching to the staff for utilization. The Registered Nurse Liaison will have human resources involved for recruitment, and then the Director of Nursing and Director of Marketing will share responsibility for the clinical oversight and then the oversight of the marketing component. The Enhanced Digital Marketing Campaign will fall solely under the Director of Marketing. For target measures, the target audiences are patients and family members, the community health systems, and then another target measure is deepening our community outreach and engagement while having that promotion of the Hospice Brazos Valley brand. We want to maintain the organization's vision while gaining an increased market share value, and to assess the outcome and effectiveness of this, we can use survey data analytics to see what type of outreach we are gaining, and we will utilize Health Pivots data in addition to data, which is a CMS third-party surveyor that sends surveys out to caregivers post-death of a patient. Potential disruptions obviously include the global nursing shortage, which has caused us to suffer in the amount of available nurses in the community for jobs. So recruitment success will decrease unless we have not only marketing externally, but simultaneous internal marketing to create enhanced employee loyalty and buy-in to remaining within the organization and promotion of it as an excellent place to join as a new team member. Another potential disruption or anticipated disruption would be the continued influx of new smaller hospice agencies each year that are trying to enter into the market and take out small percentages of that market share as well. For volume projections, so here we see the projected volume growth of admissions per year as we're scaling that 15% increase over 3 years. So in 2021, we had 885 admissions to hospice, averaging about 74 per month. Growing this by 15% over 3 years would give you a new average of around 1,018 potentially, or a potential average of 85 per month. This would equate to approximately 11 additional patients or admissions per month versus where we were at in 2021. Obviously, there are variances in each year due to anticipated market share fluctuations related to competitors and the number of hospice-appropriate patients within the community. Again, here we can see an anticipated volume projection of monthly reimbursement based on our average daily census. So in 2021, we have the average daily census of approximately 135 patients. Medicare reimbursement rate for hospice care is fixed at $203 a day. So you will see that gave us an approximate reimbursement rate of $27,405 per month in 2021. And scaling that through the next 3 years, you'll see our average daily census begins to climb from baseline of 135 upwards to 157 potentially in 2024, which will only further increase that projected monthly reimbursement based on that $203 fixed reimbursement rate per day. So in conclusion, the importance of developing a comprehensive marketing plan will bring anticipated benefits to our organization and the community. Community members will become more educated on their healthcare service options and what best meets their current needs in life. There will be potential jobs created for nurses in the community. Our providers will have a stronger relationship with the organization and options for their patients to receive care. And basically all of these benefits will support the established pillars that we set out and created in our strategic plan of families and their patients, team members, community, and growth.